And if one is not realizing what's going on, it can continue to grow?
Correct, and that's what will happen. See, what happens as the years progress and you get older, the tissues get weaker, the intra-abdominal forces that we're going to talk about in a little while that lead to progression of hernia, that will allow the hernia to grow with time. It'll go from a small little belly button hernia over to a big one. It'll turn into a golf ball and eventually an orange-sized ball.
Is this by chance or hereditary?
So it's a combination of both. Of course, the incisional hernias occur because you've had surgery, but the ones that you are born with, like an umbilical hernia or a baby that's born with an inguinal hernia, it is you know, it is something that's coming from birth, you know.
We have risk factors to look out for in case you are at risk for hernias. Let's take a look at some of these. Male gender, really?
Well, it's just that hernias are more common in men.
Okay.
And so that's what it is. But I think the basic principle that you have to take back is anything that would increase your pressure in your abdomen. So, of course, pregnancy, which is increases your intra-abdominal pressure. Obesity, when you have a lot of fat inside your abdomen as well. Smoking, because of the chronic coughing. So smokers have a chronic cough, and if you're coughing all the time, you're increasing your intra-abdominal pressure, and that, of course, will lead to hernia or allow your hernia to progress much more rapidly. Those who have constipation, whether they have just chronic constipation because of colonic disease or because, God forbid, they have a tumor in their colon or something like that, they can lead to as well to a hernia or progression of a hernia. Maybe you have a small hole, is what we call subclinical, a small little hole in your abdominal wall, not really noticed, but because of the coughing and because of the straining, it progresses over years and then it becomes evident.